Good afternoon and good evening to everyone who has joined this webinar. And thank you. I hope everyone is safe and healthy while we fight this pandemic with all our strengths. Few guidelines before we start with this webinar. One, everyone will be on mute by default, and we'll also be recording this webinar. Also, regarding the questions, please post your questions if you have any in the Q&A section of this meeting. We will definitely address them at the end of the webinar in the Q&A phase. So today in this webinar, we will be talking about leveraging RPA for healthcare services added with design thinking for innovation. My name is Sandeep Joyce, and I am the RPA technical lead. I also have with me Gangadhar Koidala, RPA software engineer, and Durgesh Verma, Vice President of Digital and SAP. JK Technosoft, a part of the JK Group family, is a high IQ company, as the logo says, and is a global software service and solution company enabling clients to deliver sustainable success by providing value-driven services and solutions. We are part of different services and solutions where we have advisory services and platform solutions, and also we are into enterprise solutions and digital solutions, which has the digital enterprise, the AI-driven analytics, RPA, chatbots, and independent quality engineering services. The agenda for today's webinar would be like this. We will talk about the current situation with COVID-19 and how healthcare is a highly stressed area now. We will then discuss about the 5 priorities for success which we have identified and the era of robotic process automation. We will also discuss about few generic use cases for healthcare shared services, and then we will see what design thinking is and how it is involved with RPA to bring innovation. Continuing with this, we will also see how to RPA and what is the delivery framework of ours, and then we open up the platform for Q&A. To start with, the 10 challenges to tackle on the way to become an intelligent in the healthcare industry is as below. We have, with highest percentage, the declining number of reimbursement claims, patient experience, IT maintenance and cyber security, qualified new hiring, compliance with government mandates, whatever we have, implementing alternative and different payment modes, also consolidation across different players in healthcare, digital patient engagement, and increasing drug cost. So if we crack these 10 challenges, we can become an intelligent domain in the healthcare industry. So to discuss about the current situation with COVID-19, as we all know that the world is going through this pandemic, healthcare is one of the most stressed area now. There is a drastic increase in the number of patients, leading to increase in diagnosis, delay in getting test results, and also in the consumption of medicines and also manufacturing. On the other hand, dealing with insurance claims has also become very tough. We know that 90% of insurance companies do not have the ability to adjudicate the COVID-19 claims. And also, on the other side, there is a staff transaction increase from 2,000 to approximately 11,000 plus in numbers. Because of all these parameters, the global economy is supposed to grow by an extra of 2.4% in 2020. To overcome these and to be the new normal, we have identified 5 strategic priorities which are necessary for an healthcare organization to transform their business. 1. Improving the patient experience. which involves the patient in the process of his healthcare. The patient knows what he is going through and what is being taken care of. Subscription to the patient outcomes. So the time spent by patient in waiting for his turn to be diagnosed or for a doctor or waiting for his or her test reports, which can be avoided to save time. Then we have to operate smartly and efficiently. This is being done by automating the repetitive and manual processes like preparing the reports, preparing the bills, or communicating the test results via electronic media to the patient. This can be achieved. So that's what we will do in operating things smartly and efficiently. And also enable data-driven decisions where we collect the data and we analyze that data to take further decisions and decide on good strategies and goals for the organization. Then empowering the workforce. So we should have some level of authority for automating things and bringing some changes to the business. So how do we cater these? The answer to this is robotic process automation. As we all know that this is the era of robotic process automation, where RPA, we will call it as RPA from now, holds great potential to increase efficiency quickly and also decreases costs by automating the most manual, most repetitive, and high number of processes. The processes which are there with high volume of records and which are very repetitive, they can be automated and the cost can be decreased and efficiency will be increased. So how does it benefit? Let's see the strategic priorities in detail to understand how does it benefit to us. To start with, improving the patient experience. We definitely must make sure that the quality of care is given to the patients. How do we do that? By making them part of the prevention programs, give them self-service option to create ease and confidence. Also by making them part of patient loyalty programs, where patients not only earn perks and rewards, but also experience the consistent care given to them. Also, time to recovery, onboarding experience, and various services which will help onboarding to the patients will result in quality of care of the patients. It is forecasted that 67% of the patients will book or change or cancel appointments online, with this trend rising in the following years. So now let's move ahead and see how this health engagement and experience is there in the current scenario. So as of now, what we have is the patient has little to no involvement in the treatment process. So basically the patient is not aware of what is happening around him when he is going through diagnosis or the treatment. And also low patient satisfaction result will be there in low adherence to patient care plans. So if we are not involving them in the patient care plan directly, we are just treating them, diagnosing them, treating them, and continuing with the diagnosis. Inefficient care delivery and low cross-organization communication will or may result in duplicate tests and also no consideration of the impact on the patient currently. So the 4 point what we were talking about is patient consumerism with connectivity of sensors and increase in devices. Patients are not involved in to know what is happening, and also they do not have an overall picture. So how do we see this? How do we see this in the new world scenario where we can completely automate it? We can call it as intelligent RPA. And let's see how the new scenario looks for patient experience. So as you can see, the new world scenario, as we discussed, we can completely automate it and we can increase the patient experience. So to start with the 4 points we discussed in traditional scenario, These are the examples for automating them and to create a patient experience here. To start with, what we can do is we can educate and engage patients to discuss with them about their conditions and positive approach towards it, where we can have electronic media involved and have a great and very healthy conversation between the patients and the health centers, where in the background tasks are taken care by RPA, intelligent automation, and the patient is being engaged. Also, we engage patients throughout their care plan and try to expand beyond the traditional care model. So here, ongoing patient marketing throughout the care plan, we include them. They know what is happening in the care plan and how they are involved there. So this will create the ease and confidence with positivity for them. We also follow up to ensure positive outcomes, automated and proactive notification of care plans and service to ensure compliance and also to trigger the next planned activities based on the patient's feedback. So here we can ensure that by having some background tasks automated and having this engagement with the patient continuously on the electronic media, we can have proactive notifications to them of what are the care plans and what is the compliance, and it will definitely improve the outcomes if we have it as an interaction from the patient side as well. And yes, automated patient surveys where we can pick up the inputs from there and we can use it as improvement areas for the next steps. And also based on the inputs, we can just decide on what is the next activity which can be taken care of. We continually optimize patient experience. Uh, This can be done by integrating with the patient history database. And what we can do is we can have artificial intelligence assisted proactive patient communication. As we discussed that if there is a healthy interaction via electronic media with the patient and the health centers, it would save a lot of time and definitely the inputs can be taken as feedback and we can have the patient history also involved there so that we can take much better steps for the next real world evidence tracking, which will definitely help us in future usage in population health outcome research and optimizing the data there. Now, moving on to subscribing to patient outcomes, which we refer to as phase from diagnosis to recovery. So the traditional scenario, as everyone is aware of now, when a patient signs in with the admission desk at a health center or a hospital, so basically he or she will visit the desk staff registered there with the relevant details and fills in, submits a lot of different forms. And once that process is done, a triage is performed by the nurses. Basic details like blood pressure and the pulse and heart rate are picked up as notes. And then the doctor carries out the initial examination, suggesting the next steps, what we have to do, any tests are needed or any diagnosis is needed further, and continue with the diagnostics. Now, the patient goes to the waiting room with hand-filled forms, and then the patient starts waiting for the doctor to call that patient and start with the diagnosis. Basically, they are waiting for their turn. And once the diagnosis happens, the diagnostic results are made available. The doctor again calls the patient, discusses the results, and prescribes medications, or he assigns administrative staff and schedules for any critical stuff, like if we have any surgery or any other tests which is crucial, they will again schedule an appointment for that, and then they hand over the patient with all relevant information. So here, what the only problem I see is a lot of manual tasks and a lot of waiting time of the patient and the doctor as well. So it can be utilized for more core tasks, and in the background we can automate with a lot of activities here. So we will see that in the new world scenario where we will use intelligent RPA and we will try to save as much time as possible And we will also see that the saved time by the doctor or the patient will be utilized for core different tasks. So how do we do that? What can happen is the patient can already sign up using his electronic media applications. He or she can input the triage details and the previous medical history and the personal information when they are signing up via their electronic device. So they are saving the time of coming to the reception desk and waiting for their turn and get their admission there and wait for the doctor. So meanwhile, they do this immediately, the health center or the person who is attending them, they can have this data permanently available with them. So immediately they can go through it, and before calling the patient to the hospital or before they reach, they can be ready with the services which they have to give them or the diagnosis if there are any tests or if there is anything to be done that can be prepared ready. So what the patient does is he waits for the further information about the diagnostic results by coming down there, and they can receive a notification, intelligent communication on their devices saying what is going to happen next, what are the diagnostic results, which doctor they are supposed to meet now, and all those things. So as you can see here, all these manual tasks are interrelated and they can be completely automated by using intelligence, artificial intelligence, and all the processes in the background. So basically what we are trying to do here is save a lot of time by automating the repeated processes, have some intelligence to clear the gap and have a very healthy conversation and engagement between the health center and the patient, and let the doctors and the nurses concentrate on the core tasks so that they are avoided with the documentation or the wait time. So this is the new world scenario, and this can be definitely automated using intelligent RPA with very less hassles. Now, the next and most important thing is in this phase is the process of admission to cash. The time from the patient is admitted, then diagnosed, treated, and discharged. So this process has a lot of check and maintaining the billing context. So basically, the checking and maintenance of this billing context, whatever is happened in the phase, is a very crucial and a manual task. So basically the process starts with receiving the patient files and checking the billing context once they are ready to get discharged. And also a lot of different contexts are checked for what material has been consumed, what is the medicines which have been used for diagnosing or treating the patient, what are the tests conducted on the patient, or if the referral information, if there are multiple doctors, surgeons, or any other kind of doctor involved into this, the referral information has to be recorded step by step and assessed while billing. So all these things are complex and very manual. So there is a chance that uh, many errors can occur due to the incorrect manual input of data here. For example, during the billing or admission, if the age of the person by mistake is entered wrong, and during the time of the billing, obviously they have to go through all the documents, all the bills, all the medicinal slips and everything. So if the data is wrong, it has to be corrected, and definitely it will consume some time because first it is a manual editing of billing items, and second you have to change all the documents where that data is referred to. So this is a time consuming process. And the last thing, sending every case to billing and the dispatch of the bills once it is ready. So how do we see this? How can we overcome this traditional scenario with new world scenario? So what we can do is we can have a highly automated and intelligent end-to-end process automation with machine learning and artificial intelligence. Full automated billing with no user interface. We can have such interfaces. Exception handling and integrating clinical documentation and also billing details on a single screen. So during the billing, if any information is to be referred, in case of automation, we can have them as dashboards, and we can just refer out on the screen, all the data on the screen as graphs. So that will reduce a lot of confusions or manual errors. So what happens in this scenario is the case is ready to be built. So what happens after that is standard billing rules are implemented. The bot would have been taught about what are the billing rules, what are the calculations, how the tax is created, all the data is accumulated. We have the invoice drafts created, which is fed with the prehistoric data. If anything is paid while admitting or in the process during the time of testing, if we have paid anything, and if there is any unstructured data which is involved, like different medical records, surgery protocols, and other things. So basically, everything involving with the historic data is put together, and then the invoices are generated. So this process of having everything built, then some human being from the accounts team to confirm the proposal and then releasing the invoices can be completely optimized and intelligently automated so that we can have the invoices sent to the users, billed to the users without any human intervention. So this we call it as intelligent RPA, where engagement of the patients with the health center is also taken care, and lot of redundant and repeated activities also are automated with less errors and with very accurate data. So now all these use cases and scenarios in healthcare, what we discussed till now, needs a, definitely they need a solution, and there are a lot of ways to identify the solution. And to achieve this, what we discussed till now needs a lot of ideas. So this will definitely lead us to the concept of something called as design thinking for innovation. So before we proceed to design thinking for innovation, we also have few healthcare shared services use cases which can readily be picked up and they can be automated with very less hassle. For example, if we look into the domains what we have, finance and accounting, human capital management, patient lifecycle management, and other supply chain and logistics with IT and contact center. So to talk about these domains, what processes we can pick up easily and automate without any hassle, we have record to report. We can pick up general accounting process, taxing, treasury, and compliance related processes, financial planning and analysis, where it also has financial compliance and reporting as well. And also we have in human capital management, HR related use cases, which involves recruitment and selection of employees, their payroll and compensation, which is given, employees master data management, also their performance management, their benefits, and legal entity reporting. To continue, we also have patient lifecycle management, where the major activities which involve for patient experience, like patient interaction, patient onboarding, and patient test results collection with patient master data management and different analytics. So these are the use cases with patient lifecycle management, which can straight away be picked up and can be automated. Also, we have the most common use cases in supply chain, IT, and contact center, like material planning and transport management, imports and documentation, financial supply chain, and also production supply management with infrastructure management, application development and management, resource optimization, and definitely the most important, IT analytics. So these use cases, I'm again mentioning that are very common across the shared services domain, and they can be easily picked up without any challenges. They can be automated. Now, to talk about so these solutions, what we discussed till now, the new world scenario, the traditional scenario from which we have come to the new world scenario, there is a keyword which buzzes in everyone's mind, which is digital transformation. So digital transformation is all about the accelerated disruption of business models, and it definitely requires a mindset shift from problem solving to problem finding. Design thinking here is our best tool as it's the simplest way of using a designer's tool to find out different and new ideas, discover innovative ways of solving the problems. So how is this done? So basically this is done by design thinking workshop where we first start to understand what people really care about. We understand what exactly the user expectations are. So we do it by these three steps where we start with exploring, we create ideas, we create prototypes based on that ideas, and then we go ahead with the implementation of that. So this methodology starts with client briefing. We continue with new insights. We identify new useful innovations. Once we find out the optimum innovation and the solution for that, we implement it and we hand off the package. So how do we start? So basically what we do is we have something called as design thinking workshop where we first start to understand what people really care about and what are their expectations. So once we have these details, what we do is we start to define the problem. So once we have defined the problem, what we do is we start with the process of ideation. Once we ideate, we have different ideas, we find different and new ideas to solve the problem, and then we discuss these problems and the ideas with different people to see which one is the best. We then create a prototype to see if it is people desirable, business viable, and technically feasible, which will definitely lead us to creating the innovation by implementing what we have ideated. Now, to see what design thinking does, how it is being done, and how it works as a solution, I request my colleague Gangadhar to walk us through this use case of patient self-service and explain us briefly on the delivery framework and next steps. Over to you, Ganga.
Thank you, Sandeep. Hello, everyone. To see what design thinking does, we have this use case, which is patient self-service, a combination of conversational AI and RPA. Here, the user or patient interacts with any possible conversation channels and devices to proceed with self-service use case like check his or her appointments, reports, symptoms, or check what are the results of the tests conducted. Once this self-service task is identified by the user or patient, the inputs are fed to a robot with based on the rules start. Takes necessary actions. The solution is a combination of conversational AI layer and RPA layer, which I would say is the result of design thinking for information. Delivery framework. We have a well-defined framework to deliver the automation processes. It's broken down into 4 phases like design, develop, deploy, and deliver. In design phase, we, we will design an RPA process considering all the possible solution design patterns with a clear process design document and solution design document. We finalize the best solution architecture. All the activities of designing and finalizing a solution design is reviewed with each step so that we have the best and optimum design. In development phase, once we have agreed a solution architecture or plan of the process, then we started developing the process. We make use of well accepted coding standards and standard document templates. As like design phase, we make sure everything is reviewed before proceeding with next phase. Once we are in deployment phase, we will prepare a pre-production plan and recovery plan as standby to avoid risks. Also, we plan on monitoring and collection of metrics post deployment. Finally, in delivery phase, we provide a customized standard handbook which talks about every step of the development cycle. It is a go-to handbook to understand the process and solution design with what is implemented. Hypercare is also done as part of this phase to make sure everything is in place after deployment. For every phase, here we have a quality gates to monitor the quality and to check about the quality of each phase. With that said, the next steps for starting RPA would be to get in touch with us for any questions, for any clarifications or detailed demos for any processes across industries. For more details, please drop an email to marketing@jktech.com and we will get back to you. Thank you all. And we now open up for a Q&A session.
Thank you, Gangadhar. So we will start with the Q&A session now, and I see that uh, okay, so good. I don't see any questions till now. So if anyone has any questions, please use the Q&A window. Yes, so we have one question. Uh, have you calculated ROI on the use cases? Durgesh, you would like to take this question?
Yeah, generally it depends on case to case, but we have seen, just to give an example of recent ROI that we discussed, it was completely, there was a saving of 87% of manpower, which was utilized for more of a high level task. Then this repetitive task was completely replaced by a bot. So it's more on the terminology that what is the cost of which geo you are from, what is the salary you're paying. So in that terms, we cannot define. It goes case to case. Otherwise, yes, from an efforts purpose perspective, it is around 85% of efforts was completely automated.
Thank you, Durgesh. I hope that answered the question, Yatendra. So to move on to the next question, Alistair Nivens asks, which RPA platform is the best to use? So as of now, trending in the market, we definitely have three players, Alistair. We have UiPath, we have Automation Anywhere, and we have Blue Prism. So again, which platform is the best? All are good in their own ways. It depends on various factors like what scenario are we looking at to automate? What is the cost which we can afford to go ahead with different tools? And what kind of challenges do we have in our as-is process, which suits or which is solved best by the three different OEMs? So based on these different parameters, we can choose which one to go with. We have another question from Atenta. What is usual project duration for these use cases? So the apt and optimum project duration for these use cases is 3 to 4 weeks. And again, that is only decided based on the complexity of the process. If we are considering various scenarios and use cases, the apt project duration is, yes, it is 3 to 4 weeks of time. Thank you. I have a question from Abhishek. Hi, I am in UK right now, but my practice is in Australia. Would the automation differ in any sense? So to answer your question, Abhishek, there would be no much difference apart from the time zones. And also the main aspect which will be considered here is the systems which you use. So basically, it depends on what applications and systems you use. Some part of automation will be definitely different in each and every case. So that would be the only differing aspect in this scenario. Okay, good. Any more questions, anyone? Mohit has asked a question. Can it be deployed on cloud? So to answer this question, yes. So how bot works is technically whatever we develop is deployed into something called as process controller, which is a center place over internet where we can control the bots. So can it be deployed on cloud? Yes, we can deploy it on cloud as part of the virtual machine or the report desktop, which is there on cloud. And basically, these automations are called as unattended automations. So you have to just deploy, make sure that it works, and whenever the job is scheduled, it triggers automatically in the background and it runs on the cloud. Next question from Yatinder. Uh, does your team needs to be on site for this engagements? This Actually, there is, if we look at the process complexity and the phases of the automation, uh, maximum percentage of time, there is no need to be on site for uh, automation engagements. So basically, what happens is only to understand the process right and to convert that as is to be, there might be a need to go on site, or it can be done over different electronic medias as well. But yes, it's not necessary that the team has to be on site for these kind of engagements. Wonderful. Any more questions, anyone? Uh, Durgesh, you have anything to add?
No, I think so. Since there's no questions, we can wind up. And thank you. Thanks a lot, everybody. Thanks for joining. Thanks a lot, Sandeep and the whole team.
Thank you, team. Thank you, everyone. And thank you, Yatendra. Thanks for the compliment. It has been a wonderful session, and you have been a wonderful audience. Thank you, everyone. Take care and stay healthy, stay in. Good night.